Hello everybody. My name is Michael Langley. I'm from the PHIN Secretariat and I'm pleased to welcome you to the second webinar in the PHIN webinar program that we've begun to bring you. The topic for today is digital responses to COVID-19 in the Pacific. Now we have a tight schedule for today. Hope you're seeing the same screen that I'm seeing. We'll just move on to a bit of housekeeping. And that is not changing as I was hope it would. So while I'm trying to sort out this, can you please mute your microphone and suggesting that you turn off your video to save your bandwidth. Any questions can be posted in the chat function and they'll be answered at the end of the presentation. And of course, the webinar will be recorded and distributed later. And we'll also be having a quick poll at the end of the session, just a few questions if you can give us a bit of feedback. So, stop that and try again. Okay. So the contents for today's session, we have 4 presentations. The first one will be the aim of contact tracing, some definitions and issues to consider, followed by some information on digital tools to respond to COVID-19 technology, and then followed by technology solutions for COVID-19 from the Commonwealth of the Northern Mariana Islands. And finally, exposure notifications in Guam, featuring the Guam COVID Alert app. Now, and the objects of the session, pardon me, is that you should come up with an understanding for the rationale of contact tracing, understand what a COVID-19 contact is, understand the contact tracing process, get an overview of key digital tools available for COVID-19 surveillance and contact tracing, and get some resources. So I was hoping to be able to introduce Walter Hurrell, but I believe he's having some trouble.
I'm online.
Plugging.
Michael?
Are you there, Walter?
Yes, I'm online, Michael.
Ah, fantastic. So I'd just like to introduce Walter Hurrell, who's the Chief Information Officer in the Ministry of Health at Tonga, who's also a board member of the Pacific Health Information Network Board. And I'd like to hand over to him to say a few words. Thanks, Walter.
Thank you very much, Michael. I'll try and keep this short. So, malo lele, good morning, good afternoon, and good evening to everyone. On behalf of the PHIN, from the president, the board members, the secretariats, and the advisors, I would like to convey our sincere appreciation for your time and for your interest in this webinar. As most of you know, that PHIN has a vision that focuses on fostering digital health and supports capacity building of healthcare professionals to realize and navigate and achieve goals of the Pacific Island countries. And by supporting this vision, we have a couple of strategic goals. And one of the main goals that relates to this webinar is actually the focus on advanced capacity building and inclusive of growth. And that is one of the reasons why we're having this webinar, is to focus on those capacity building. So in light of this pandemic, we think and believe that it's necessary for us to focus this webinar around the COVID response, or to introduce some potential tools and application that will assist us in responding to this pandemic. I think it's important to note that this work that we're actually currently doing is voluntarily, and we're not gaining any financial benefits from that. So it's actually very important to receive all your support in terms of attending these webinars or sharing these webinars and other upcoming activities with your colleagues or whoever you think it's necessary to gain some skills and knowledge from these webinars. So without further ado, again, thank you very much for your time and for your interest in this webinar. I'll pass it on to you again, Michael. Thank you.
Thanks very much, Walter. Thanks for those words. So onto the presentations. Well, actually, just before we go to the first one, I just would like to also thank the Asian eHealth Information Network, which has assisted PHIN in getting going, and they're providing technical support and collaborating with us in various aspects. So thank you to AEN. Okay, I'm going to stop sharing and hand over to Katri Kontio from the World Health Organization. Katri is a health specialist in health systems, information and digital solutions at WHO, and she's also a technical advisor to the PHIN board. So over to you, Katri, to introduce us to contact tracing definitions and other issues.
Hi everybody, and sorry, this is a little technical hiccup, from my side. So I hope that you can hear me and see the screen that I'm sharing. I'm just walk you through quickly about digital responses to COVID-19 in the Pacific from the contact tracing point of view. I'm technical officer here in the Pacific sub-regional office. I'm trained in epidemiology and doing some health informatics studies, and I'm the member of Pacific Joint Incident Management Team, and I try to present, what is the joint approach, what we have for the COVID-19 response through that agency collaboration. So what the contact tracing is about simply is about separating potentially infected people from the population before they infect others. It would require a rapid identification and investigation of cases throughout identification of the contacts and assign appropriate and effective quarantine mechanism. High intensity contact tracing should be maintained as long as possible, and we should remember that this is not a standalone activity. It's always used in combination with other intervention such as physical distancing, hygiene, and PPEs. So I wanted to quickly just refresh the memory on those ones who are not epidemiologists and the part of the COVID-19 response that the definitions. So who is a contact? It's a person who has experienced any of the following exposures during the period 2 days before and up to 14 days after the onset of symptoms of a probable and confirmed case. So we are talking about someone's a COVID-19 contact if it has a face-to-face contact of confirmed or probable case within the 1 meter more than 15 minutes. It requires direct physical contact. And obviously healthcare workers or those ones that caregivers who are taking care of the COVID-19 patients without the proper person protective equipments and other situations indicated by local risk assessments. What we mean about the quarantine is a separation of the people who have been exposed but who are well from others to prevent the spread of infection and contamination. I would also note that a lot of Pacific Island countries and countries in the world, they also quarantine healthy travelers entering the countries, although they wouldn't have necessarily been exposed for the COVID-19 case. With the isolation, we mean symptomatic cases and people who actually develop the disease. Isolated people are usually isolated in hospitals or healthcare facilities. In some countries, mild cases could be home, but my understanding, the Pacific, most cases has been hospitalized. So why we need the technology? I'm saying that for the contact tracing, the speed is a key component of the success. With this slide, I just would like to show that, like when the infected came, one infected person over the time are duplicating, the cases quite rapidly. And this infectious period is the time frame that we would need to identify the person and put the person in isolation and quarantine in order to avoid that, that they would spread the disease, for the others. So if we are very slow, this period is very short. It starts around 2 days, before, the onset of the disease, when the person is developing symptoms. And around, we are in average 5 to 7 days, when the people are developing the symptoms. So we don't roughly have, the much of the time to do the effective contact tracing. So what happens in a lot of countries in the world that have community-based transmission is that your contact tracing system gets overwhelmed and may collapse quite rapidly when you start coming to more cases. And you're supposed to do all of these 3 stages: the contact identification, finding and finding the contacts and inform them, and then the quarantine and monitoring and follow-up. And if you don't have enough the contact tracings and you have a rapidly increasing caseload, you might have that, the contact tracing get exhausted. They get you're not simply enough having enough warm bodies. Your lab get overwhelmed with the high backlogs, and the whole system might collapse. However, although we think that, some of these digital tools, they might make, the contact tracing quicker and facilitate the process, there are some ethical considerations, and there are WHO guidelines, how you could use, some of these technologies, the maintaining information security, and limit data collection and make it volunteer, the systems. And my last slide, I could just say that there are evidence that, digitally enabled contact tracing and surveillance definitely help. But I would like to also say that, the whole purpose of the using digital tools is facilitate the process. So if you have a limited human resources and time and general challenges in digital health interventions and use, you might consider, are you able to do it, without creating the other problem and hinder for the contact tracing. And just in the context, I was saying that people usually have less time and possibility to get, the formalized learning, especially when the borders are closed, but they are still asked to perform high-level proficiency and adapt the ever-changing requirements. So this is just to consider whether you would think that you would be ready to adapt the tools, and if they would to provide, some efficiencies, in your contact tracing and surveillance processes. And, the last, I just would like to share that there's 2 documents that the WHO has released about establishing integrated nation-wide contact tracing systems and selecting digital contact tracing quarantine tools for COVID-19. There's a link, and they are all available online. But that's just my quick presentation before I would like to turn, to my colleague, Laura Vives, who actually talks about these specific tools and the differences and how they would be used. Over to you, Laura.
Thanks, Katri. Sorry, guys, I'm feeling a little bit under the weather, and so I may have to excuse myself by muting myself. So just give me 1 second. Aloha, ahi ahi. Greetings from Canada. Good morning, good afternoon, wherever you are. My name is Laura Vivas, and I'm actually, I work as a volunteer for the Pacific Health Information Network as an advisor to the board members. So today I just wanted to briefly run through some slides. I know that I don't have a lot of time, but I hope that I do this topic some justice. But what I want to focus on today, rather than just talk about digital tools, is really explaining the whole concept of contact tracing, which has been a term that has been tossed around since the beginning of the pandemic. So if we can add some clarity around this, I hope I can do that. But I think what's important is to really take a look at the big picture first, okay? I think it's important that we all understand that we are all in the middle of a pandemic. And a pandemic response requires some system thinking. And what I'd like to, this diagram essentially shows you that, your operational portfolio in terms of responding to the pandemic from a digital perspective is that you need to ensure that the public, that you need to engage the public, the individuals, in order to inform them, to support them, and to monitor them. And of course, you need your clinical systems like your EMRs, your radiology, your labs, particularly to test, treat, and support in recovery. And then you have your admin systems, of course, to ensure that you are managing the supply chain, the frontline workers that basically are fighting the pandemic. And lastly, but not least, you need a surveillance and outbreak response system, which is there to monitor the population, understand the situation, and lastly, to coordinate action. So that essentially is your operational portfolio. Of course, all these things are not being done just for the sake of doing it, right? These are tools to assist with with health services delivery, but also it's required to be able to provide you with some good information, some good analytics. So that includes, a dashboard and reporting for you to be able to understand, decide, and inform. And clearly, at the end of the day, we need some evidence and quantitative reasoning. No one will be able to refute if you have a solid evidence base and good quantitative reasoning. And that can only happen when you have these systems operating properly and ensuring that it is generating the information that you need. I think it's important for me to spend some time about this because I think this is really where the confusion is about contact tracing. I've had the privilege to basically serve in Fiji with Dr. Eric Rafai. We were one of the first countries in the world to actually implement the contact tracing system. But I think, if I take a step back, there was a lot of misunderstanding of what contact tracing is. So let me kind of quickly explain this. On the upper side of the slide, you have the public engaged systems, which are really engaging the individuals, okay? And that is essentially to inform them, to support them, but importantly, to monitor them. Because of the velocity of how the world has come together to develop solutions, there are a ton of COVID-19 related applications. Some are mobile apps, like you see in yellow here, and some are basically both web and mobile apps. The key here really to understand is that there is a whole series of them. The important part about this is that we are all in this together, right? And this is not a problem of the public health folks, this is a problem for all of us. So unless you are an irresponsible, anti-mask nightmare, who doesn't want to comply with anything, that would end up becoming a real problem. But you are basically being given the tools to be able to basically assist in getting through this pandemic. On the bottom slide, essentially, are really the tools that the public health folks are using. So, you have SORMAS that we implemented in Fiji, and you have GoData in a number of Pacific Island countries. But these are the tools that are being used by the public health officials. It's there to basically assist with the outbreak investigation, case management, follow-ups, and so forth and so forth. So it is important to understand that there are public engagement systems like Care Fiji, Sarah Alert, And there's also the public health tools that are being used by the ministries, such as SORMAS and GoData. What's important to understand is that these are all connected. And like I mentioned earlier, because of the velocity of how these systems were developed, there are going to be a lot of integration issues, potentially even overlapping back-end functions, which really has caused a lot of confusion to the general public who don't understand this. And this is one reason why the term contact tracing have been overly used, to mean everything, from outbreak investigation to proximity tracking. Okay. So again, what is contact tracing? It's an umbrella term that needs further explaining. So here's an important slide, okay? And I want to spend a little bit more time on this. So by taking the definition right out of the World Health Organization, contact tracing is a process of identifying, assessing, and managing people who have been exposed to a disease to prevent onward transmission. Now, if we take a look at that definition, coming out of that definition, if we can classify them into 3 categories. One is the outbreak investigation, which is your classical public health tool, proximity tracking, and symptoms tracking. So let me kind of explain just a little bit briefly. So the outbreak investigation system are the public health tools that are being used to be able, to do case investigation, do contact follow-ups, visualize, the transmission chains. And it is really meant to be used out in the field. And it is really used as a targeted way to be able to respond to an outbreak. This is a tool that your typical, contact tracer, like a warm body, is going out there basically contact tracing, to ensure that they can mitigate or minimize the amount of community transmission. And then you have the proximity tracking tools. Now, these proximity tracking tools came later on, roughly about, I don't know, maybe about April. Some of you have heard of the Singaporean Trace Together mobile app. Now, the proximity tracking tool was essentially developed to assist, not replace the outbreak investigation, but to supplement, using technology, typically GPS locations or Bluetooth signals, in identifying individuals if they've been in close physical proximity with a potential contact with a case. But of course, since probably April today, that proximity tracking tool has evolved in many different variations. You have the decentralized proximity tracking tool that was developed by Apple and Google, which removes the person on the database as soon as they're cleared after 14 days. And of course, you have something very innovative from the Cook Islands, where they use QR codes essentially for people to scan their QR codes before they enter a facility or a location. And what it does is just to track to make sure that you were not anywhere close to where an outbreak have been. So again, these are just essentially supplemental to the traditional outbreak investigation case management system. Now, an interesting development has happened, again, roughly about the same time when Trace Together was developed, called the symptoms tracking solution. And in the context of contact tracing, it's really there to help monitor contacts that have reported some kind of symptoms. I understand in the Pacific, this SARA alert is being used as well for incoming passengers to the Pacific, even though they have not been, even though they actually haven't got any symptoms. So I do understand that a lot of us are looking for workarounds, which is good, but can also be problematic down the road. But again, these are basically tools that are there to support the public health response. So again, I understand that there are some confusion about what these tools do. There are many, many more others than what you actually see on here. Some of them have their own different nuances and variations for functionality. But in essence, these are the 3 types of contact tracing tools you should consider and think about. There might be others down the road, but I'm not aware of it. So a lot of people have asked, so what is the difference between SORMAS versus GoData? Back in March, okay, actually back in February, Fiji was they took the pandemic very seriously. They were one of the very first countries that have implemented border control measures. And the ministry was also, determined to ensure that they delay the importation of the virus. So we were the first ones that started, looking for a contact tracing system, even actually an active surveillance system, as a matter of fact. There really wasn't a lot out there in the market, and we ended up, through the help and collaboration of the Fiji CDC and the Ministry of Health, we actually implemented SORMAS. That was, I believe, we've implemented SORMAS on March the 30th, about 10 days after the decision was made to go ahead with it. And then, of course, there's GoData. And I would only like to really speak to these 2 tools because this is the two contact tracing tools that are being used in the Pacific. Now, I took this this diagram from the John Hopkins University research, which was dated July 2020. A lot of these things are a little out to date, but I can quickly go through them. If you take a look at GoData, in terms of ease of use, they scored very high. It's a great tool. It was intuitive to use. But I also want to just highlight that, back in July, there was not an active developer community and forum, but they do now. In terms of adherence to standards, GoData, when they first released it, I'm not really quite sure exactly what kind of standards they were using, but it was highly proprietary. But they've released different versions of GoData by changing their architecture, and they now actually support, HL7 and FHIR and so forth. And so they should, right? So that it would allow them to integrate to other health information systems or surveillance systems. It has a pretty good built-in analytics, but it does not have what we call two-way messaging with patients, meaning it cannot communicate with the patients. Security is good. It provides multilingual support. And then you can basically see here that it is turnkey for use. It's integrated to your labs. And again, lots of use cases for this. If I move on to SORMAS, again, they're very, very similar in functionality and capabilities. And of course, some of them have improved beyond, for example, multilingual support. It supports about eight languages right now, given the fact that SORMAS was rolled out in France and in Switzerland right after Fiji. So I think it's really important to just mention that the Pacific had a big influence on how some of these products have evolved, being the early adopters. So again, from an outbreak investigation, both SORMAS and GoData have very similar functionalities. The difference, I think, and I probably need to validate this again, but I'm sure of this, is that compared to GoData, SORMAS has a port of entry functionality. And because of the feedback that we have given the German center who basically built this system, it now basically allows you to survey quarantine flights. Because at one point in time, we actually had to enter passengers as cases, although they don't have any symptoms or anything like that, and that really kind of skewed the numbers, right? But they now have that functionality in there, and there's possibly more things. GoData is a public good, global public health good. It's free. So is SORMAS, but the only difference is that you will have to basically pay the Helmholtz Center of Research, who developed the system in Germany to configure and install the system for you. So let's talk about proximity tracking for a little bit here. I'm not going to go into the details of this other than the fact that it is basically Bluetooth based, meaning it tracks the, it basically tracks the proximity between you and another person. And lo and behold, in Cook Islands and in New Zealand, they have I wouldn't call it, well, it is a proximity tracking tool, but it's not Bluetooth enabled. It's actually QR code enabled. And it enables you to be able to track locations that you have visited to ensure that you did not come from a location where there has been an outbreak. So a couple of things that you need to think about when you do when you adopt proximity tracking, okay, is how do you install this? This has always been a problem, or people don't know how to use it, people don't know how to install it. Sometimes the phones are too old. So a lot of times they ran out of batteries. Sometimes they forget to turn off Bluetooth and forget to turn it back on, and so forth. Okay, so including the fact that I borrowed my spouse's phone, all that kind of stuff. Now, our assertion here is this: if in order for this to work, the uptake is key. Again, let me remind: this does not replace your classical outbreak investigation tool. It supplements it, and our analysis shows that you need to have at least 60 to 80% uptake of your population, before this tool becomes really useful. And here in Canada, where I'm based, we're now finding that the tool isn't working as well as it should, even though they've actually upgraded and made changes to how the Bluetooth should work. So again, something to keep in mind. And the reason why it was the adoption for this proximity tracking tool was strong was because in Singapore it was something that worked for them. But keep in mind, Singapore got this tool out early. There was a lot of downloads, at that point in time, early during the pandemic, and as a result, and of course there's other non-pharmaceutical interventions like social distancing and so forth. So we cannot necessarily say that this tool essentially saved Singapore, okay? But I think it's important to understand that you do not have this false security that this thing actually is all you need. It doesn't work that way. Now let's move on to symptoms tracking. Symptoms tracking, again, is a mobile app that monitors individuals at risk for COVID-19. The cool thing about this is that it provides real-time insights and reporting capability, in order to help the public health folks contain the virus. What this does is that it allows people who have been diagnosed with COVID-19 or, importantly, potentially exposed to report their daily symptoms in different platforms, either using your computer, your laptop, your mobile phone, and it can be done through text or email and so forth. The thing about this is that when that information is actually being collected, that you submit, right, the patient submits, it estimates a predictive value of certain symptoms to determine the kind of intervention that they would need for you, okay? And from a health system perspective, it also allows you to it allows the healthcare system to better utilize their resources and to follow up and coordinate care based on the prioritized need. So that is a cool thing about this. So quickly, what are the key takeaways here, okay? And a lot of this is basically my experience, both in Fiji and in Canada, implementing these systems or supporting the ministries with the systems, is that first and foremost, you need ongoing senior management and fiscal support past COVID-19. I understand that right now COVID-19 is top of mind, but what happens after COVID-19 is done? What will happen to these tools? You got to keep in mind that these tools, has some use, depending on tools what you use, okay? But some of these tools have some use beyond COVID-19. So for example, in Fiji, we have SORMAS. One of the reasons why SORMAS was basically adopted or selected was that it can be used beyond COVID-19. It is an active event-based surveillance system that can be used for any communicable diseases. So again, but we want to make sure that the senior management team understands that, when you have these tools, it's just like children. You gotta feed it, you gotta, clothe it, you gotta look after them, right? Second point is you need to understand how all these tools work and supplement each other. And I know that I went really fast today and trying to explain the 3 different types of contact tracing tools, but you need to understand how they work and how they, supplement one another. The third point is workarounds, and this is something that I really would like to stress. Okay, once you start doing workarounds, it's like egg. You can't unscramble an egg once you break it. It's done, right? You could try to piece it back together, but it's going to be very difficult. Once you introduce workarounds, it compromises the analytics and the reporting that you get out of the systems. So be careful. I do understand, we had the same issues in some other jurisdictions. We had to find workarounds, but now, we have to figure out a way to unscramble that egg. The other thing is, if you do not have the proper infrastructure in place, don't even start, because these tools require a lot of computing infrastructure, whether these are servers, laptops, mobile devices, tablets, you need something like that. And the other thing is you need to secure sufficient contact tracing personnel. This is not about technology doing the job. This still requires people to do the contact tracing. You need change management, which is really important, particularly for the contact tracers who have not experienced using, a digital surveillance and outbreak investigation tool. And you always need to continuously refresh the training of the personnel. That does not stop. As a matter of fact, the training happens regularly. And in here in Saskatchewan, Canada, where I'm from, the contact tracers are trained almost every 3 weeks, because there's always new functionality. There's always new features coming out of these contact tracing systems. And you also need to ensure that you have ongoing technical support from your vendors. They should be your partners to help you through every step of the way. We were very fortunate in Fiji that we actually had some really good, dedicated Germans from the Helmholtz Institute supporting us, even though it was like 2 o'clock in the morning. Again, here's the thing. You need to also make sure that you have adequate mobile devices. One of the lessons learned is that because these contact tracing outbreak investigation contact tracing systems are deployed in the field, you need to make sure that their mobile devices are going to be able to withstand some of the harsh conditions out in the field. And they should be rugged and pretty heavy duty. Last 2 points, you need to integrate other legacy tools to improve system-wide analytics. A lot of times these systems are being used strictly as a standalone system, but the power and the magic, of all of this happens when you can start integrating, for example, your outbreak investigation to your lab. These things basically are very, very powerful stuff. And lastly, you need to really understand the total cost of ownership, so that there are no surprises down the road. And you need to make sure your executives understand what the TCO is. So I hope I did this, map some justice, but I've started to, I was collaborating with Katri and we were just plotting where some of these contact tracing tools have been deployed. And of course, you can see that in the US territories, they pretty much have Sarah Alert, some Go Data in Palau and in FSM. And of course, in New Caledonia, they're basically using Go Data. So it's in French Polynesia. And Cook Islands basically has Go Data for their contact tracing and CookSafe for their proximity tracking. And lastly, but not least, Fiji being the pioneers of surveillance and contact tracing for COVID-19, they have SORMAS and a derivative of Trace Together called Care Fiji. So mahalo, and I think that's it for me. Thank you very much.